Okay. What I like to do in supervision is to remember that we're talking about two people. We're talking about the person who is sitting with me, who is asking for supervision, and we're talking about the person who sits behind her, if you will, the patient that she is presenting or that he is working with. And so there is this double quality of working with somebody who is seeing another person, and you're, in a sense, trying to respond to what's being done primarily with the person you're supervising, but certainly also with the person who is sitting behind them in the office where they work. So what I like to do is to focus on the evolution of the supervisee, how that person has grown, or what there is that they can learn. What possible things have they not tried that they might like to explore? And can they support that kind of exploration? And the process in supervision then is to encourage them and to show them how to support or how to suggest some kind of improvisation, something they might not have tried before, and in some fashion see to it that they get a sense of what's new and move a little beyond the customary therapeutic boundaries that they have set for themselves or that they assumed were in place when they began to practice. Very often what you're dealing with when you deal with supervision is the individual's assumptions about how he or she is supposed to behave. And if you can question those assumptions and maybe loosen some of the unique characteristics that the person has, you've done, I think, a good job. So that what you're looking for is how to sense the uniqueness of the person you're supervising, how to sense whether that person can support or improvise that from that position, and then to see what happens when and how this new direction may be introduced. So that you're dealing with a very complicated evolution that takes place under conditions where another shadowy person is not in your office and not available for you, but their welfare is also connected. So it's a kind of double connection that you have to be responsible for. What I'd like to do is to start by working with one volunteer and then discussing some of what the conditions were, and maybe if we have time to work with yet another volunteer and see how some of the same things develop, or to see if there are different themes that surface and what we may learn about it. And I'd also like to save some time for questions. I assume you use the mic in the middle of the aisle over there, and let's see how we do. One of the first things that I think of in supervising somebody is what are their gifts, what are their talents, what is there in them that is unique and valuable, and are they using it? Several years ago, many years ago as a matter of fact, I was teaching a graduate course in psychotherapy, and I was asking the graduate students what they consider to be some of their best qualities, their best personal qualities. And they listed things like a sense of humor, a good knowledge of music or art or sports, and a whole range of skills that they had. And I asked them, when they walked into the therapeutic office and they closed the door behind them, how many of those skills did they take with them? And what did they add to them? And you would be surprised at the self-censorship that went on. We began to replace some of the qualities that were lively and engaging with qualities like caution, attentiveness, serious purpose, and various things like that that were all worthy, but that also left out some of the loveliest qualities that they had that would make them unique as a therapist. Because what you do in supervision is to show that individual what's possible without squelching the individuality of that particular individual. So if you happen to know that they know something or they have a certain skill or talent, somehow to find the relevance of that to their function as a therapist can be one of the most liberating things you can try. So let's see if some of those things apply and how that might work in an actual supervision session. Okay, I'm going to lower my hand now, and I'm afraid you're going to disappear. But, you know, send me a care package, as I've said. Okay. Okay? Hi. Hello.
Hi, Wendy Schulhoff.
Wendy?
Yeah.
Good. Somebody said these were supposed to be unobtrusive. Don't you believe it?
I feel like Madonna.
Oh, really?
Well, I would have spent more time on my hair if I knew I was going to be on camera today.
Okay.
I'm in a rough situation right now in regard to more than just one family, although I'll limit it to one family in just a moment. I'm transferring agencies. I'm a clinical social worker.
You're what?
I'm a licensed clinical social worker here in California, and I'm switching jobs. I'm leaving an agency I've been at for 2 years and moving on to another one. And I'm terminating with 7 families and their children, their adolescents, many of whom I've worked with weekly for 2 years. And the context of my interactions with them, these are foster children who are special needs kids who have been identified with psychiatric, behavioral, emotional problems. And I see them in the home.
And what?
I see them in the home,
You
not
visit
in,
the foster?
in the office, which lends itself to a very intimate relationship. I mean, I come and do my visits at their home while they're folding their laundry and making dinner, and you know, it's a very intimate setting.
Yeah, you work with the whole family?
Well, I see the kids alone, I see the foster parents alone, then I see everyone together.
Oh, all
Yeah.
in their own home.
Not my home, their home.
I
Yeah.
said their own home.
Yes.
Yeah.
Yes. And the termination is probably equally difficult for me as it is for them. But in my 10 years of social work, this is the first job I've had where I've had long-term relationships with clients. All my other jobs, and I'm sure it's what's the word I want? I can't think of the word, but you know, I worked in a psychiatric hospital where I saw patients just very briefly. I worked as an emergency psychiatric assessor where I would go to the medical emergency room and do a one-shot deal and say goodbye. Yeah. I've had jobs where I worked with patients very, very briefly. And due to my own growth, I think, and my own therapy and all those things, I chose a job where I could have long-term relationships.
Where you would have what?
Long-term relationships.
Which is the job you're just talking about
Yeah.
now that you're leaving.
Right. So over the next 2 weeks, I will be terminating with these families. There's several of them who are the foster parents in particular are very dependent on me. And I'm really in a quandary. I'm scratching my head. Did I do something to allow an overly dependent relationship to form? And I'll focus now on one family in particular. There's a couple that I work with. The father is Hispanic, the mother's Caucasian. They have 2 of our foster children, a 9-year-old little girl and a 15-year-old.
Girl?
Girl, they're both girls.
Do they have any children of their own?
No, she was not able to get pregnant. They're in the middle of adopting the 9-year-old, and that's going to go through. We know that's going to happen. The foster mother is dysthymic and has very much some dependent personality traits, and calls me at the office. I see them weekly. She calls me at the office for the least little thing. She even, my name's Wendy, she calls me Wen. I mean, only my closest friends call me Wen, except for this foster parent.
It sounds like she calls you whenever.
That's true. Yeah, that's true. She even called me one time when her husband had suffered a trauma. He was almost it didn't really happen, but he was almost carjacked. And she didn't know where to turn, she didn't know what to do, she called me. And that, of course, that has nothing to do with my role with her family. Mm-hmm. And she's a good-souled woman with a big heart, but her boundaries with the children are not what I would like them to be.
How old is she?
She's about 32.
Mm-hmm. And what kind of a family did she come from?
She's the oldest of 3 girls and is very, very close with her 2 sisters and her parents. Her parents live in the same apartment complex they do. And
yet in an emergency she calls you.
In this one case she did.
Uh-huh. Okay.
Yeah. Their apartment is, part of our agency is we go out and we inspect the places these kids live and make sure that they're clean and safe, and if there's a fire, people could get out. And how this apartment passed that scrutiny, I don't know, because it's just deplorable. I mean, it's so messy and stuff just crammed everywhere that it's such an uncomfortable, sad place just to sit in. I mean, I'd be depressed. She doesn't work.
Yeah.
And I would be depressed just sitting there all day looking at this mess.
And yet she does nothing about it.
No, she's physically impaired somewhat. She's very, very obese, and she's very somatic. Very somatic. One of the most somatic people I've ever known. And never feels well. There's always something wrong, and that she'll tell me about in great detail. And I guess my biggest concern is some of the things she says to the kids. As I said, the younger child is being adopted. And
by them?
By them.
Yeah.
Yes. And this has been going on they've had this little child in their home for 2.5 years. The older child has been in the home for a year in just a couple weeks. A year is sort of a magic number to a foster child because after a year, they're eligible to be adopted.
Oh.
So this older child is saying, okay, my little sister's getting adopted. Now I've been here a year. What about me?
Mm-hmm. Mm-hmm.
And the foster mother is reacting to that with, you're not adopted. How does she word it? You're not adoption material yet.
That's a very technical way for her to put it.
Yes.
How do you account for that?
Well, what she said was that this 15-year-old still saw her as a foster parent rather than a family member. And until she could see her as part of her family, she wouldn't be willing to consider her for adoption.
Yeah, but her language, the way she put it, was relatively technical. You're not adoption material. Mm-hmm. That sounds like, what an authority behind her might say, but it doesn't sound like it comes from her. Does it strike you that way? Or does it seem consonant with what you know?
No, it feels congruent with the way she way she states things.
Mm-hmm. The way
that's how she talks.
Uh-huh.
Yeah.
That's very interesting.
Yeah. And what my concern is that I'm able to come into the home and take her aside and have the kids go play and say, you know what, Jody, that's really not really what we need to remember is that we separate behaviors from the worth of the child. And I know that Susie said something that upset you, but that's not what Susie's about, and that you have to be the parent, and this is the child, and as a parent, your role is to again, separate the paper from the child and, be the bigger person, and she cannot withstand hearing that she's not adoption material because she said something to you that upset her. I mean, it's the same thing saying to a 2-year-old, I don't love you because you're having a tantrum. And if anyone else had said that to her, she would have blown up. I mean,
If anyone else had said exactly what you said,
yes,
she would have.
She only will accept this feedback from me. And examples of that are, all our children have county workers as well as people like me. And there was one county worker who gave her feedback about a case, and she was suicidal over this feedback. She called me up and said she wanted to kill herself.
Oh boy.
Yeah.
That's quite a tantrum.
Yeah. Yeah. Exactly.
Yeah. So what do you do about that?
Well, I'm telling her this coming week that I'm leaving the agency, and
So she doesn't know yet.
she doesn't know yet.
Uh-huh. What do you predict?
Well, I'm trying to pay someone to tell her for me.
Pardon? What? I'm sorry. You were...
So I'm trying to pay someone to tell her for me.
Yeah.
And then I thought of leaving the country. It's very, very tough because, as I said, the intimacy in which you have with these people in seeing is. You wouldn't think it would be such a big thing seeing them in their home instead of seeing them in an office setting.
That's for sure.
But it really does change things.
Sure, sure. It's an invasion of their
Yeah.
life. You're on their life territory.
Yeah.
What would you say to her if you didn't have to be careful? I mean, starting from scratch about your leaving and your concerns, what would you say to her?
If I didn't have to be careful?
Without caution.
Well, I would say some really pretty nasty things about the job I'm leaving, but there might be someone out there I work with, so I won't do that. I would just be very frank with her. I would just say that the time has come for me to move on to another position. It's a growth move for me, and something that I've been working towards, and I know that's going to be a very difficult transition for her. But that I know that the new worker who's going to replace me will be empathic and helpful, and I will help as best I can.
Is that true?
No, I don't know who's going to be.
That's right. I think you should be very careful to tell her what you know to be true. So what would you say to her if you were just going to tell her the truth?
It's really hard.
Yeah. What makes it so difficult?
Because out of my own arrogance, I feel like no one can work with her the way I can work with her.
You what?
I feel like no one can work with her the way that I can work with her, and it's taken 2 years for me to get to this place. But I know how to go in the back door and get across the information I need to get to her without her blowing up, and with her hearing me and actually changing her behavior. I mean, I can go into the house when the tension is so thick you could cut it with a knife and work with her and her husband, and when I leave, everyone's laughing.
Yeah. So you're
I manipulate.
convinced.
I mean, I know how to manipulate her.
Well, some people call manipulation influencing.
Yeah, there you
but
go.
It's still the same thing.
Yeah.
But you know you're doing a good job. There's something unique about the job you're doing.
I'm very genuine, and what I say comes from the heart.
Yes.
And I genuinely care about her and her children. And I think that's the hardest thing about terminating with all the families I'm terminating with, is I genuinely care for these kids.
Yeah. Okay, taking all that into account, what would you say to her from that, whether she's ready to hear it or not? What would you say that would really represent what you're thinking and feeling. This is not necessarily a rehearsal to trot right out and do it, but so that you know where you're coming from.
I think I would say, that it's been very special to me to work with her and her family.
Say you, as if you were saying this to her. Because what I noticed is when you started talking that, the tone of your voice changed. It got softer. So if you could continue, but just as if you were addressing her.
Okay. It's hard.
Pardon?
It's hard.
Yeah, take your time.
Okay. Jody, Jody, it's been very special for me working with you and your family, getting to know you over these years, watching Aliza grow and change in the way that she has with the nurturing you've given her, watching your patience with Laura. I've learned from you. I've appreciated you welcoming me into your home every week. I know with a little help that you're going to be able to get through the tough times that we all know will come as they do with working with the special needs kids that you have. But you also need to know that I'm going to be moving on.
Yeah. What are you feeling right now?
I want to cry.
Like you feel sad. Could you say that to her?
Yeah.
What would you say?
What I want to say, I think, would be clinically, I think would be unethical.
Well, okay, but maybe the important thing is to get it out, not necessarily. This is not a rehearsal,
Right.
For you to go out and do
Yeah.
this, exactly.
Yeah.
It's in a sense to see what it is that there is in you that you may or may not express, but that you know where you're coming from.
Well, I don't want this relationship to end. I mean,
So there's some mutuality there.
yeah. Not just with her, but with most of my cases.
Yeah.
I want to give them my home phone number, my home address, and if you need anything, call. And
Yeah. It's been a big part of your life.
yeah, it's been professionally. It's been the first time in my life where I've had long-term professional relationships with clients.
Yes. And they're leaving it now.
Mm-hmm.
So what are you feeling?
I think the hardest thing about it for me is that I think being a foster parent is, we have a continuum certainly at our agency of folks who are more well-suited for the job than others, but most of our foster parents are incredible people who take children into their homes with tremendous problems that they didn't cause, and they bring them into their home and treat them as their own and try to heal scars that they didn't make. And
Yes.
I get tearful sometimes just being in their homes, watching them nurture these children that are not their own, and watching these children start very, very slowly to build some attachment. And some of them are not able to, but some of them are. And
This is interesting. Can you imagine? I've forgotten the woman's name.
Jody?
Jody.
Jody.
Jody. Can you imagine telling Jody what she has accomplished in the time that you've known her? Not merely that you're moving on, but some acknowledgement of what she knows now, what she's learned, what she's done. That at the beginning, neither of you knew. was possible. What could you acknowledge about her growth in that period?
Her biggest growth in that period has been the two girls that she has. As I said, one of them she's had for 2.5 years, and one she's only had for 1 year, and that's the older one. And I think her biggest growth has been in learning to set appropriate consequences for the 15-year-old. She was giving her consequences as if she was a 9-year-old, like the other child.
Yeah.
And she was willing to listen to feedback from me of what were appropriate and okay behaviors for a 15-year-old. And no, you don't do a timeout, in the corner for a 15-year-old. I mean, and she listened, she took that in, she integrated it, and she grew from that.
Yes. Can you say that to her?
Yes.
Can you tell her what she has accomplished in that time, not just you? How would that feel?
It wouldn't be the first time I've told her that.
No, but this would have a kind of summation effect.
Yeah, I could tell her that.
Pardon?
I could tell her that.
Yeah. How does she react when you tell her what she's accomplished? How has she reacted in the past?
She has a hard time accepting compliments. Yeah.
Yeah. But you could tell her that. How would it feel to you to acknowledge what has happened, instead of just walking out sadly?
That feels a part of me to acknowledge that. I mean, that would be a very genuine gesture.
Yeah. Yeah. What are you feeling right now?
I feel that despite every best effort I'm going to give and how genuine I'm going to be and how lovingly I'm going to say all of these things, that she's still going to that because she has, I hate to use DSM kind of lingo, but she has some access to kinds of features, and I feel like despite however well I do this and however genuine I do it and how much from the heart it is, that to some degree she's going to decompensate. And I think she'll regroup, and I don't think it's going to be the end of the world, and she'll learn to work with the new worker, but I think there's going to be a time of crisis for her.
Yeah. You look sad again. Yeah.
Well, I can't make it better.
No. Yeah.
And it's a lot for me to take on, because this is one of 7 families. I mean, I'm not terminating with one family, I'm terminating with 7. And this is maybe one of the harder ones, but this is kind of all at once.
None of them will be easy.
No.
Yeah. Well, what could you say to yourself, Wendy?
What?
What could you say to yourself about what you've accomplished? It's been, 2 years, you said?
2 years, yeah. Oh my gosh, so much.
Good.
So much.
What would it be?
I've learned how to relate to children. One of my teenagers, I often take the kids out with me to spend some alone time. And one of my teenagers said, Wendy, there's something I've got to tell you. I said, well, what is that? The thing I like about you the most is you don't even talk like a social worker. So I thought that was a really, really big compliment.
Yes.
I'm very genuine with the kids, and I know that I can feel it. I can feel they pick up on that.
Can you feel your generosity?
Yeah. When I'm with them, they have all of me.
Yes. Yeah. Just let that resound a little bit.
It's making me think of, I have a little 8-year-old who, whenever I come over to the house, I've never asked her to do this, but after she got to know me a little bit, she would jump in my lap every time I'd come over to the house, unsolicited. And I started tickling her one time, and I thought, oh my gosh, this child's been abused and molested. And I said, Lisa, I am so sorry for touching you without asking you if it was all right.
Yeah.
And she said, yeah, you're right. You're on tickle restriction. And she had me on tickle restriction for about 6 months. And then one day she jumped in my lap and she said, you're off restriction. And these moments with these kids are just magical to me. They're just magical. With some kids where they're acting out all over the place and they have these horrible problems, and I look at them and say, none of this is the problem. What do you mean? You're mad at your mom. And they start to cry. And I have to take them alone and spend an hour with them, and it's the most poignant moments. It's been a very, very special 2 years.
Yes, you've learned a lot.
Yeah.
And is it worth the pain and separation?
Yes.
Yeah. Try again, Wendy, what you might say to, I've forgotten her name again.
Jody.
Jody. Try again, knowing what you know about what the experience was like for you, with the specific memories that you'll carry with you. What would you say to Jody?
Like when I tell her that I'm leaving?
Yes.
I think with her, I would start by saying, oh gosh, it's going to be so hard. Jody, I need to talk to you about something that's going to be difficult for you. And what you need to know, let me just put it right out there, is that I'm leaving the agency and moving on to a new job that's going to have more opportunities for me and is a good move for me. But the negative side is that we're going to have to say goodbye. And I know that's hard for you, but what I'd also like you to know is that it's maybe equally as hard for me. And I appreciate, what I said earlier, I appreciate you having welcomed me into your home every week for these years, watching you work with the children, watching Elisa be such a happier, more content little girl. I admire your strength. I admire your patience. I've learned from you. I'll miss you. I'll think of you.
Yeah. Can you imagine her response?
What would her response
What
be?
her response would be?
I think the fallout's going to come later. I think probably she's going to be like in shock. And probably won't say much at all then. Mm-hmm. But I think what will happen is over the next couple of weeks, my last 2 weeks at the agency, there'll be crises.
Mm-hmm. Okay.
That she'll create.
Yes. Okay.
And my gut says I should interpret them for her. That, does this have anything to do with the fact that I'm leaving pretty soon?
Incredible. You have to give her a handle on it.
Because that's sort of how she operates.
How what? She operates?
She creates crises.
That's right.
Yeah.
Mm-hmm.
Yeah.
Yeah. Could you point out some alternatives that she might do something different that would make the goodbye more, acceptable, satisfying, realistic in a sense?
Well, one thing is that the little girl who's being adopted, there's several workers they had before me, and they're planning this huge party when the adoption goes through, where they're inviting everyone who's ever worked with this little girl.
Ah.
And the names of the prior workers are all available at the agency, and they know they can access, not get their addresses directly, but they can send a letter through the agency saying we're having this party, the adoption has come through.
Mm-hmm.
And I can remind her that I plan to be there, that the agency will make me aware when that happens, as a way of not making it so final, like that we'll never see each other again.
Well, completing it in a celebratory fashion.
Yeah.
Yeah. And what can you say to yourself?
What would I say to myself?
Yeah.
To not be so arrogant and to believe that someone else can work with her too.
Mm-hmm. Yeah. You know what I'm missing in that?
What?
I'm missing some sense of how dear some of these people have become to you.
How dear what?
How dear some of these people have become to you.
Oh my gosh, yes.
Yeah, but why not acknowledge that? It doesn't mean that you'll do anything against the ethos of social work, but it means that you know they've become dear to you.
Absolutely.
And that you have that capacity. And that it has probably informed some of the most beautiful moments you've had with them.
Absolutely.
Yeah. Can you feel that possession? Yeah. You know, in a sense, there's a kind of parallel that you have to pay attention to that is more drastic with Jody, but is still very painful with you. To know some of the joy and connection and accomplishment that you've had is not antithetical to feeling sad that you're leaving. It's a mix. It's a mix. And you're entitled to feel that whole mixture. And maybe after that also a little bit of the excitement of moving on. Right? Yeah. That's what's next.
Yeah. It's a good move for me.
Pardon?
It's a good move for me.
Yes. Yeah. Would it be okay if we stop there?
Yes.
Yeah. Okay.
Thank you.
You're welcome.
You're welcome.
Thank you. Okay. Oh, there you are. Any questions or wishes? It was for me, it was a very interesting piece of work because it was there was a kind of parallel to it. Jody rearing the two girls and Wendy, in a sense, rearing Jody and the two girls and what happens that way. And the sense of one of the difficulties that Jody has in life is that she doesn't have a good appreciation of what has in fact been accomplished. It doesn't nourish her. And that could be a very infectious process. In other words, Wendy could feel that way too because Jody does. So that it's very important to get a sense of what Wendy's statement is and what Jody's statement is and how they differ and what might be affected by that. But to be able to do it, if you can, with a sense of the, the drama behind it is a very engaging process. It allows her to get a sense of the dramatic and of her role in it and to appreciate her role and also just to touch, because it was time to move into some sense of where she was going, the excitement of where she was in fact going. Jody doesn't have that necessarily, although she might, you could speculate that she'll have a little bit of that feeling when the adoption is legal. There's, some possibility there. But the sense of also for Wendy, for moving on, for what's next, that doesn't frighten her. What's next frightens Jody, but it doesn't frighten Wendy. And it's important to separate that. Okay? Any questions or observations? Yes?
Some supervisors, when they work with a supervisee, focus almost exclusively on the needs of the patient, and other supervisors do a lot of work with the supervisee's personality and needs. I noticed that in this case, you affected what I thought of was a brilliant balance between the two. The question I have is, do you generally work this way, attending both to the personality of your supervisee and of the client, or does it depend on what you sense in the personality of your supervisee?
Yeah, it depends on what I sense in that person, what the struggle surrounds, what it centers around. So that would be often very influential for me, what the particular circumstance is. You're welcome.
Would you like to have a hat? There's a gentleman here who would like to offer you his hat so you don't have to put your hand up.
He would offer me what?
A hat.
A hat? Oh, that would be a nice idea. Will it work? Also, who is the next volunteer? Yeah, terrific. Who am I rooting for? Okay. Yeah, I see. Oh, this is terrific. Okay. Thank you. It's terrific that we're photographing this. I love it. Now you can see how a nice, great, big, grown-up therapist behaves. Hi. What's your name? I'm sorry that we're going to have to hurry a little bit.
Okay. My name is Steve.
Steve? Mm-hmm. Okay, and what did you want to talk about today?
Well, I am currently working with a woman who has kind of losing the will to live, and I've been doing everything I can to try and share with her how important, that she's valuable and that she's a worthwhile person, and but I'm not able somehow to engage her in wanting to live. And she is bulimic, and
How old is she?
pardon?
How old?
She's 51. She's been bulimic since she was 19 when she was in college. And she
just managed to skim along the edge and stay alive.
She has managed to do it. She's had tests, they do check the electrocytes and all the different things for years, but she's at the end. She's right now, her body is broken down so badly and so much that I keep telling her, I have to be really upfront with her. I've been trying to anyway, if this is the right thing to do, to let her know how close she is to the edge and that she is going to die.
How does she take that information?
She knows it, and she says, she just told me last week that she wants to just get a gun and end it. And she was the oldest of 3 daughters, and much was expected of her when she went to college. And she says that she's never been able to please her family or to, I guess she's just not been good enough in her own eyes. And she currently is staying indoors. She will come and see me very early in the morning. I don't usually do this alone early in the morning, but she'll show up at 6:30 or 6:45 in the morning.
With an appointment?
Yes, I do this just for her, just
Okay.
because otherwise she won't go out on the street. And she writes, I have her write out things that are happening to her in her daily life as much as she can. She's fairly well educated. She's very verbal. And she's able to use concepts and understand much of what's going on. She's been in all kinds of they've sent her around the country for different kinds of therapies. And I received her because everyone else had given up on her. And she's just recently I was looking at her hair, and I could see that she's got trichotillomania. She's pulling out all of her hair.
Oh.
She's been pulling out her hair, and she also is shoplifting. She has 5 items that she shoplifts: bacon, cookies, butter, avocados, and something else that's greasy.
Yeah, I was impressed, yeah.
And I've tried to work on that with her about the fact that not to take her backpack in, not to wear coats that have pockets.
What does she do with the food after she
She
steals it?
eats it all.
And then purges.
And then she purges it, for feeling guilty about the shoplifting.
Uh-huh.
But she's to the point where she's actually, her insides are, she's has suffering. And she's a very beautiful woman. She's just got so much expression in her face, and I just know there's so much that she could do. And so I've tried to engage her in things like successful things. Like I had her plant a nasturtium seed in her window in her enclosed apartment.
Mm-hmm.
And I had her do a simple jigsaw puzzle of a picture that she would like to look at. And I've had having her carry a photo of someone that she's loved in her life when has to go out on the street, so that when she's fearful, that she'll talk to that photo and try and make herself feel that it's all okay for her.
Those are very inventive activities. That's very clever of you.
I have to try and think up things that fit the person, because they're all different. And even the diagnosis, to me, I don't understand the diagnoses, because these people are normal. They're wonderful people with something that's happened in their lives.
Well, let's not talk about these people. Let's talk about this woman.
Okay.
Continue. Does she have any family?
Does she have a what?
Family?
No. She's never been married.
Sisters or brothers?
She has 2 younger sisters.
Oh, and do they live in the same town as she does?
No, they don't. They live in other cities, but she is in touch with her, one that's the next to the oldest to her.
Mm-hmm. And is that interchange satisfying?
They talk.
Yeah.
But the family wants to stay out of it because they've been so involved in her process for so long that they keep a distance from her. They do invite her for holidays.
Yeah. And she goes?
She goes, but she feels that she's being punished.
Punished?
Yes. She says that being around her parents, she knows that they don't love her, and she knows that she's not good enough. And then being around her sisters, and they're successful, and they have good husbands. And
oh, I see. Mm-hmm. She's 51?
She's 51.
She must have been seeing other people before you.
She has.
And what was that relationship like? What do you know about it?
She says that everybody's been very therapeutic. She can tell you all the diagnoses and explain. She says that I am the first person who is ever willing to come in early in the morning and who has, tried to help her find something to make her want to live. She said...
Yeah. Is she an ethical person?
Does she what?
Is she an ethical person?
An ethical person?
Yeah. I mean, if you were to think about her, would that word come to mind? Does she do what she's supposed to do? Is she even-handed in her relationships with other people when they...
I believe she is, except when you're looking at ethical things, if you use that word, then the shoplifting isn't ethical, but it's her only way of resolving that awful pain.
What income does she have?
Pardon?
What income does she have?
What?
Income?
She is on Medicare and Medicaid.
Yeah. Mm-hmm.
So she has about, I think about $649 a month. She lives in low-income housing.
Yeah. Mm-hmm. The reason I'm saying that is I'm trying to figure out if there's a bargain you could make with her. I mean, like you're willing to come in at 6:30 in the morning. What is she willing to do?
And that is the problem. She's willing to write down what is happening after she steals or after different things occur that make her feel bad. And she writes them down beautifully. And she leaves them in envelopes for me to read.
But is that what, did you ask for that, or was that her choice?
No, I asked for it.
Yeah.
I was trying to get her to look at her own writing, to see her own imprint of what is happening versus only thinking about it.
Yeah.
Because I was thinking that the thinking isn't doing any good right
It's
now.
all internal. Yeah. Well, what would you like her to do? Could you give her a humorous assignment to pay you back for getting up at 6:30? Anytime she asks you to get up at 6:30 to see her, what might she do?
What could she do?
Yeah,
for me?
what act might she do that would compensate you for that extra
I
early
don't-
morning rise?
I don't know.
Make up something.
I've suggested that she watch some movies that have humor and have feelings of life, and that she could tell me about them.
I think you're making the assignments too big.
Okay.
I'm aware of the time, and I want
Yes.
to move. I think you're making the assignments too big. What about walking around the block? Just every time you come in early, when you're done, she has to go home and walk around the block once or twice.
Yes.
Get some exercise.
Yes.
Or some other very simple activity like that, something to get her moving. Not sitting and contemplating.
Right.
Does that feel possible?
Oh, yes.
Yeah? Would she do it? Well, if she's an honorable woman, as you said, she knows you get up early, so she would feel that puts it in the balance.
She shows up, and she would do that, but she doesn't continue to do things. You know, she also has some depression in there with
Yeah. Yeah.
and so she tends to fall off, and then she feels guilty and feels like she's not meeting my expectations. And I agree with you about the assignments being, that's why I tried to do simple
Yeah,
things.
no, I think the planting nasturtium, I thought that was a very clever assignment. Just something that's small and containable, that she can do almost immediately, that you could assign to her and keep the bargain even. You know, like you have to, I'm speaking to her now in a sense, not that you'd say this, but what you want is for her to be at least as invested in feeling better as you are. And if it's honorable to do it by way of saying, okay, you maintain the relationship to me by taking a walk, and I maintain the relationship to you by getting up early to see you at a more advantageous time. And that's how we keep the bargains honorable. It'd be interesting to see how she would respond to somebody having a claim on her, you know? Because it's, in a sense, it's as if she's rejected any possibility of people requiring anything of her or giving her anything. Does that feel possible?
It is possible.
Could you come up with some assignments like that?
I
I said
could.
walking.
Yeah, I could. I guess my biggest fear, and I know that our session's just about over,
Yeah.
is that I am worried, and I guess it has to do with myself, about her going ahead and not making it. And it's hard for me to adjust to that feeling that,
Oh, yes.
that I'm going to lose her, and
Yes.
I'm going to feel a great loss.
She's going to lose herself. She's going to lose herself. You can do everything you want to do, but there are times when you can't save somebody. But you can try, and then not do to yourself what she does to herself. It doesn't help her, and it doesn't help you. So if you can get a sense of what your inventiveness might do, and invite her to feel better. See how she responds. You know, bulimics, don't they get over it in their later years? Isn't it supposed to be something that...
If they don't die.
Yeah, if they live
The
that
problem is that her body, there's certain signs that, and she does go to the hospital, and she has ways of making up for, the binging.
Yes.
She tells me she compensates because she doesn't really want to die, but she just has that feeling that it's, that if it keeps going on like it is, that she has no choice. And I do believe she has choices.
That's right. And you can use those in saying, okay, if I get up at 6:30 for you, What are you going to do for me? And connect her to you, even if it's indebtedness. Connect her to something that she has to pay. And see what that would do.
I will try and do that.
Yeah. Yeah, I wish you luck. I wish you luck.
Thank you.
Yes, you're welcome. You're very welcome. That's tough, not to get caught in a trap like that. Where a person's life is more valuable to you than it is to them. It's really murder. But I think, thank you. But I think that some sense of what goes on between the two of you in a lively fashion and an inventive fashion, just to take her by surprise in some way, is frequently a very important element in the work. Do you have any questions or observations that some of you would like to make? Yeah.
I was wondering, I noticed with both of the supervisions that, from my point of view, there might have been some personal reasons with both of the people that affected them, and it seemed like you tended not to go there. And I was wondering if that was related to the supervision, because it's supervision and not therapy, or whether you go into people's needs and feelings and on a deeper kind of level too.
No, it's part of the present circumstance. What I try to do when I am working under circumstances like this, where it's going to be a one-shot deal and we won't see each other again, is I try to make the work as complete and self-contained as I can.
Okay.
Not to leave any sort of messy loose ends. Looking towards something that might be done, but not necessarily moving towards a great step that is involved in a sequence of things, because we don't have the luxury of sequences. This is the only time I'm going to be here. So I tried very hard to keep it self-contained, and yet with principles that might apply beyond a single session.
Okay, thanks.
Yes. Anybody else? Okay. I think that the use of supervision, the supervisory relationship, is a very dear one. And for us to recognize it and to try to put it in terms of a human exchange rather than technical. We used very little technical language, and I think that is an extremely important way to do it, in the sense of retaining the humanity of the exchange. But the humanity is twofold. The humanity is that of the person who never comes into the office, the patient whom we only hear about secondhand, and the therapist who is before us and weighing the decisions and the pros and cons of the relationship that he or she is in right now. And for us to deal with that in supervision is to deal with a double responsibility, to remember, who stands behind the person we're talking with. So for me, supervising is always an invitation to try a little differently, to go down a corner, to turn a corner that hasn't been turned before, and maybe discover what's there, and discover in the meantime some capacity that they might not have known, and to move into claiming a little bit more of their own expertise, their own therapeutic authority. And I think that to work in supervisory capacity is, to me, a very satisfying possibility. I enjoy it. I hope you've profited from it too.